everybody, welcome back to my channel, and if you're new to my channel, welcome. My name is Lynetta Walker, but you could call me Nurse Netta. I'm a licensed vocational nurse based out of California, and let's get to this video. So in today's video, I'm going to be talking about the differences between working as an LVN in a nursing home versus working as an LVN in the hospital. Even though you're a licensed nurse, working in these two different settings is two completely different experiences. In the nursing home, you have a set group of patients that you see long term. You might have discharges and admissions, but for the majority of the workload, you're going to be dealing with the same patients every day, giving the same meds every day, seeing the same doctors. So everything's pretty much routine and repetitive. In the hospital, working in the ER, you're going to be getting patients in and out, in and out, in and out. You might see a 5-year-old child, then you might see a 19-year-old, your next patient might be an 80-year-old, and then you'll see a 31-year-old. So it's very unpredictable. You'll be seeing patients who have like lacerations, broken bones, fractures, maybe symptoms of a UTI. Typically, as LVNs, we don't take care of STEMI patients, which is patients who are, having a heart attack, or stroke patients. Those patients go to the RNs in the back. So we take care of the less severe patients, more like urgent care. That's basically what it is. Our area for the LVNs is basically like a mini urgent care. Also, in the nursing home, you give the same medications and everything is routine. You might give Pepcid, you might give Prilosec. You're giving set routine medications for blood pressure, diabetes, stuff like that. Whereas in the ER, you're going to be giving more injections of antibiotics, maybe some steroids if you want to open up the airway. You might give epi if a patient's having a severe allergic reaction. What else? We tend to give a lot of Zofran for patients having nausea, vomiting. So we do things like that. It's more diverse when you're working in a hospital versus in a nursing home. One other difference is doctors. When you're working in a nursing home, the doctors typically, from my experience, are very rude. I work night shifts, so anytime I would have to call the doctor at 2-3 o'clock in the morning, trust me, I got cussed out. I got my ass handed to me by doctors before. Whereas doctors in the ER, they're literally side by side with you. They're right there. You could tell them whatever you want to tell them. They give you your orders, you give them medication or do whatever procedure you need to do, and that's that. So I like the fact that the providers are right there and you can tell them whatever you need to tell them. You don't have to call them or text them or wait for a page or page them and wait for a call back. They're right there. Another difference I've noticed working in the ER versus working in the nursing home, when I worked in the nursing home, there was a lot of beef between shifts. So day shift would beef with PM shift, and PM shift sometimes would beef with AM shift, and nobody really fucked with night shift. Like, we were the underdogs. But in the ER, it's more of like a collaborative team effort. I don't really hear the back and forth too much, or not yet at least. But it seems more of a positive atmosphere, less drama. There's going to be gossip anywhere you work. That's just normal. But it's not as bad to me as what I experienced working in a nursing home. Another difference that I've noticed working in the hospital versus working in a nursing home, there's more room for growth and more room to advance in your career. When I worked in a nursing home, I was just stuck as the LVN, and that's it. Unless I wanted to go into management, which I'm just not interested in because I like bedside nursing and having that patient interaction. I don't really want to work in management. And that's really the only time you get to advance as an LVN. You're basically stuck doing the same thing. And in the hospital, I can go back to school, get my RN license, and I can grow within the company. I could still stay at this hospital, but I could transition to a different department if I want to. If I'm over the ER and I want to do L&D, which is my dream. I want to work in labor and delivery so bad. But even if I change my mind, if I want to go to the ICU or the OR or the NICU, whatever, maybe med surg, there's room for growth, and there's more of a variety to choose from, whether, you know, it's working with more critical, like critical care, or just doing med surge. Whereas in the nursing home, you're just kind of stuck as an LVN, passing medications, doing treatments, admissions. It's just no room for advancement in my opinion. In the nursing home. Also, I think that the workload in the ER surprisingly is less. Like, the workload is not that bad. Everything is fast paced and it goes by so fast, but the workload is not that bad. Whereas in a nursing home, we were expected to do so much. In the nursing home I worked in last, the LVNs on night shift were pretty much the supervisors. So we didn't have an RN supervisor on shift. It was just me, another LVN, and our CNAs. So if there was a code blue, we were responsible for it, you know, in running it. If anything was to happen, it was on us. We didn't have anyone really to go to in, you know, physically that would help us out. Another difference working in the hospital versus working in the nursing home is the schedule. When I was in the nursing home, I would work 8 hours, 11 p.m. to 7:30 a.m. And now I'm working 12 hours, 7 p.m. to 7:30 a.m. And that might seem like a long time to some nurses, but you get more off days. When I was working, typically you work a 4-2 schedule in the nursing home. So you work 4 days and then you have your 2 days off. When you work night shift, it really feels like you have a day and a half or half of a day really off, because you're not getting enough rest. Whereas in the ER, I can knock out my full-time hours 3 nights and then I'll have 4 nights off. So I like the flexibility of the scheduling. And even in my hospital, I don't know if all hospitals are doing this, but in my hospital, they're doing a self-schedule service now. So you go in the computer system yourself, you pick the days that you want to work and the days that you want to have off. And I thought that's really neat. So if I have, you know, an event to go to, or if I have a family function to attend or whatever, a birthday party, I can choose to have that day off, or I could request not to work on that day and just set my days myself. And I think that's really nice. I didn't have that freedom and that variety working in a nursing home. The next thing I want to talk about, the difference between working in a hospital versus a nursing home, is the moolah, the money, honey. So I worked night shift. The entire time I worked in nursing homes, I've typically worked night shift. I orientated on 7 to 3 when I got my other job in the nursing home, and then I did 3 to 11 shift for about 2 months, and then I just went back to night shift. But in the hospital, when you work night shift, there is a differential. So you get $2 in addition to your regular salary. And there's a weekend differential. So if you work nights and weekends, that's $3 more, honey, than, you know, on top of your regular salary. And in the nursing home, they don't offer night shift or weekend differential. So that money is a plus. And the last thing I want to say, the difference between working in a hospital, in the ER, and working in a nursing home, is the security. We have security. When I worked in the nursing home, I worked in Rialto. Those of you who are familiar with the area know Rialto is not the best city. And then my second job was in Ontario, but I was like in the hood of Ontario. So I was on the street where there was nothing but apartment complexes, and then there's this nursing home. So there was no sense of security when I worked in the nursing home. You know, homeless people would just walk in, or drunk people or crackheads is walking around, and I didn't feel safe, especially with working night shift. I just did not feel safe at all. There was no security whatsoever. At least with my other facility in Rialto, we did have police here and there that would kind of patrol the area, but people's cars still got broken into, and, you know, shit still happened. In the hospital, honey, the security is top notch. So ain't shit about to happen, and if it does happen, it's getting taken care of. So the security is A1. So, in my opinion, I'm way more satisfied and fulfilled working in a hospital. Even though I'm new to the hospital already, I just feel the difference. It's a more positive atmosphere. And I know every hospital is different, but my hospital is great and I have no complaints, honestly. I love the people I work with. I love the shift I work. I love the department I work in. And I'm so, so, so happy. And I'm just so satisfied. I have been wanting this for so long. I love my career and I've always loved being a nurse, but I didn't really like my jobs. And now I feel complete. I feel fulfilled that I have a career that I love with a job that I love. And I honestly have no complaints. I'm genuinely happy. So hospitals over nursing homes any day, honey. So that's all I have for you guys today. Let me know in the comment section what you think of the video. Let me know your experiences. Maybe you're an LVN who has experience in the nursing home, or you're an LVN in a hospital. Let me know in the comments what you think, what videos you want to see from me next. And until next time, I'll see you guys later. Love you.